Hi everyone, welcome back to my YouTube channel. In today's video, I will be talking about Medicare Physician Fee Schedule Final Rule for calendar year 2024. Let's get started. On November 2, 2023, the Centers for Medicare and Medicaid Services, or CMS, issued a final rule that announces finalized policy changes for Medicare payments under the Physician Fee Schedule, or PFS, and other Medicare Part B issues effective on or after January 1st, 2024. Background on the Physician Fee Schedule. Since 1992, Medicare payment has been made under the Physician Fee Schedule for the services of physicians and other billing professionals. Physician services paid under the Physician Fee Schedule are furnished in a variety of settings, including physician offices, hospitals, ambulatory surgical centers or ASCs, skilled nursing facilities, and other post-acute care settings, hospices, outpatient dialysis facilities, clinical laboratories, and beneficiaries' homes. Payment is also made to several types of suppliers for technical services, most often in settings for which no institutional payment is made. For most services furnished in an office setting, Medicare makes payment to physicians and other practitioners at a rate based on the full range of resources involved in furnishing the service. In contrast, physician fee schedule rates paid to physicians and other billing practitioners in facility settings such as a hospital outpatient department or an ambulatory surgical center reflect only the portion of the resources typically incurred by the practitioner in the course of furnishing the service. For many diagnostic tests and a limited number of other services under the physician fee schedule, separate payment may be made for the professional and technical components of services. The technical component is frequently billed by suppliers like independent diagnostic testing facilities and radiation treatment centers, while the professional component is billed by the physician or practitioner. Payments are based on the relative resources typically used to furnish the service. Relative value units or RVUs are applied to each service for work, practice expense, and malpractice expense. These RVUs become payment rates through the application of a conversion factor. Geographic adjusters or geographic practice cost indexes are also applied to the total RVUs to account for variation in cost by geographic area. Payment rates are calculated to include an overall payment update specified by statute. Calendar year 2024 physician fee schedule rate setting and conversion factor. By factors specified in law, overall payment rates under the physician fee schedule will be reduced by 1.25% in calendar year 2024 compared to calendar year 2023. CMS is also finalizing significant increases in payment for primary care and other kinds of direct patient care. The final calendar year 2024 physician fee schedule conversion factor is $32.74, a decrease of $1.15 or 3.4% from the current calendar year 2023 conversion factor of $33.89. Caregiver Training Services. For calendar year 2024, CMS is finalizing its proposal to make payment when practitioners train caregivers to support patients with certain diseases or illnesses, example dementia, in carrying out a treatment plan. Medicare will pay for these services when furnished by a physician or a non-physician practitioner, such as nurse practitioners, clinical nurse specialists, certified nurse midwives, physician assistants, and clinical psychologists, or therapists, which can be physical therapists, occupational therapists, or speech language pathologists, as part of the patient's individualized treatment plan or therapy plan of care. Evaluation and management visits. Beginning January 1, 2024, CMS is finalizing implementation of a separate add-on payment for Healthcare Common Procedure Coding System or HCPCS code G2211. This add-on code will better recognize the resource cost associated with evaluation and management visits for primary care and longitudinal care. Generally, it will be applicable for outpatient and office visits as an additional payment, recognizing the inherent cost involved when clinicians are the continuing focal point for all needed services or are part of ongoing care related to a patient's single, serious condition or a complex condition. Specifically, CMS is finalizing that the add-on code cannot be billed with an office or outpatient evaluation and management visit that is itself focused on a procedure or other service instead of being focused on longitudinal care for all needed healthcare services or a single serious or complex condition. Split or shared evaluation and management visits. Split or shared evaluation and management visits refer to visits provided in part by physicians and in part by other non-physician practitioners in hospitals and other institutional settings. For calendar year 2024, CMS is finalizing a revision to their definition of substantive portion of a split or shared visit to include the revisions to the current procedural terminology or CPT guidelines such that for Medicare billing purposes the substantive portion means more than half of the total time spent by the physician or non-physician practitioner performing the split or shared visit or a substantive part of the medical decision making. Telehealth services under the physician fee schedule. For calendar year 2024, CMS is finalizing their proposal to add health and well-being coaching services to the Medicare Telehealth Services list on a temporary basis for calendar year 2024 and social determinants of health risk assessments on a permanent basis. CMS is finalizing implementation of several telehealth-related provisions of the Consolidated Appropriations Act of 2023, including the temporary expansion of the scope of telehealth originating sites for services furnished via telehealth to include any site in the United States where the beneficiary is located at the time of the telehealth service, including an individual's home. The expansion of the definition of telehealth practitioners to include qualified occupational therapists, qualified physical therapists, qualified speech language pathologists, and qualified audiologists. The continued payment for telehealth services furnished by rural health clinics and federally qualified health centers using the methodology established for those telehealth services during the COVID-19 public health emergency. CMS is delaying the requirement for an in-person visit with the physician or practitioner within 6 months prior to initiating mental health telehealth services and again at subsequent intervals as the Secretary determines appropriate, as well as similar requirements for rural health clinics and federally qualified health centers, and the continued coverage and payment of telehealth services included on the Medicare Telehealth Services list as of March 15, 2020 until December 31, 2024. CMS is finalizing that beginning in calendar year 2024, telehealth services furnished to people in their homes will be paid at the non-facility physician fee schedule rate to protect access to mental health and other telehealth services by aligning with telehealth-related flexibilities that were extended via the Consolidated Appropriations Act of 2023. CMS is finalizing that they will continue to define direct supervision to permit the presence and immediate availability of the supervising practitioner through real-time audio and video interactive telecommunications through December 31, 2024. CMS believes that extending this definition of direct supervision through December 31, 2024 aligns the timeframe of this policy with many of the previously discussed public health emergency related telehealth policies that were extended under provisions of the Consolidated Appropriations Act of 2023. Telehealth services furnished in teaching settings. In the calendar year 2021 Physician Fee Schedule Final Rule, CMS established a policy that after the end of the COVID-19 public health emergency, teaching physicians must have a physical presence to bill for their services involving residents, including Medicare telehealth services. CMS finalized an exception for residency training sites located outside of a metropolitan statistical area or MSA, in which case the teaching physician could be present through audio/video real-time communications technology. To be consistent with the telehealth policies that were extended under the Consolidated Appropriations Act of 2023, CMS exercised enforcement discretion through the end of calendar year 2023 and is finalizing a policy to continue to allow teaching physicians to use audio/video real-time communications technology to be present when the resident furnishes Medicare telehealth services in all residency training locations through the end of calendar year 2024. This virtual presence will meet the requirement that the teaching physician be present for the key portion of the service. Medicare Part B payment for preventive vaccine administration services. In June 2021, CMS announced an additional payment for in-home COVID-19 vaccine administration, which was established on a preliminary basis during the public health emergency. Based on resource costs and data showing that this payment has helped improve healthcare access to vaccines for underserved Medicare populations, CMS is finalizing their proposal to maintain this additional payment for the administration of a COVID-19 vaccine in the home and to extend this in-home additional payment to the administration of the other three preventive vaccines included in the Part B preventive vaccine benefit, the pneumococcal, influenza, and hepatitis B vaccines when provided in the home. Effective January 1, 2024, the payment amount for the in-home administration of all four vaccines will be identical. That is, Medicare Part B will pay the same additional payment amount to providers and suppliers that administer a pneumococcal, influenza, hepatitis B, or COVID-19 vaccine in the home. This additional payment amount will be annually updated using the percentage increase in the Medicare Economic Index and adjusted to reflect geographic cost variations. CMS is also finalizing their proposal to limit the additional payment to one payment per home visit, even if multiple vaccines are administered during the same home visit. Every vaccine dose that is furnished during a home visit will still receive its own unique vaccine administration payment. Behavioral Health Services. For calendar year 2024, CMS is implementing Section 4121 of the Consolidated Appropriations Act of 2023, which provides for Medicare Part B coverage and payment under the Medicare Physician Fee Schedule for the services of marriage and family therapists or MFTs and mental health counselors or MHCs when billed by these professionals. Additionally, CMS is finalizing their proposal to allow addiction counselors or drug and alcohol counselors who meet the applicable requirements to be an MHC or mental health counselor to enroll in Medicare as mental health counselors. Marriage and family therapists and mental health counselors will be able to begin submitting Medicare enrollment applications after the calendar year 2024 Physician Fee Schedule Final Rule is issued, and they will be able to bill Medicare for services starting January 1, 2024, consistent with statute. CMS is also implementing Section 4123 of the Consolidated Appropriations Act of 2023, which requires the Secretary to establish new HCPCS codes under the Physician Fee Schedule for psychotherapy for crisis services that are furnished in an applicable site of service, any place of service at which the non-facility rate for psychotherapy for crisis services applies, other than the office setting, including the home or a mobile unit, furnished on or after January 1, 2024. Section 4123 of the Consolidated Appropriations Act of 2023 specifies that the payment amount for psychotherapy for crisis services shall be equal to 150% of the fee schedule amount for non-facility sites of service for each year for the services identified as of January 1, 2022 by HCPCS codes 90839 psychotherapy for crisis for 60 minutes and 90840 which is psychotherapy for crisis each additional 30 minutes list separately in addition to code for primary service and any succeeding codes. Additionally, CMS is finalizing their proposal to allow the Health Behavior Assessment and Intervention or HBAI services described by CPT codes 96156, 96158, 96159, 96164, 96165, 96167, and 96168 and any successor codes to be billed by clinical social workers, marriage and family therapists, and mental health counselors in addition to clinical psychologists. Health behavior assessment and intervention codes are used to identify the psychological, behavioral, emotional, cognitive, and social factors included in the treatment of physical health problems. CMS is also finalizing an increase in the valuation for timed behavioral health services under the physician fee schedule. Specifically, CMS is finalizing their proposal to apply an adjustment to the work RVUs for psychotherapy codes payable under the physician fee schedule, which CMS is implementing over a 4-year transition. In response to public comments, CMS is also finalizing the application of this adjustment to psychotherapy codes that are billed with an evaluation and management visit and to the HBAI codes. CMS believes that these finalized changes will begin to address distortions that have occurred in valuing time-based behavioral health services over many years. Section 4121B of the Consolidated Appropriations Act of 2023 also established that the hospice interdisciplinary group is required to include at least one social worker, marriage and family therapist, or mental health counselor. Therefore, CMS is finalizing its proposal to modify the requirements for the hospice conditions of participation to allow social workers, mental health counselors, or marriage and family therapists to serve as members of the interdisciplinary group and removing the proposed language requiring that the determination regarding whether a social worker, marriage and family therapist, or mental health counselor serve as a member of the interdisciplinary group depending on the preferences and needs of the patient. Additionally, Section 4121B of the Consolidated Appropriations Act of 2023 allows marriage and family therapists and mental health counselors to furnish services in rural health clinics and federally qualified health centers. CMS is finalizing the requirements for the rural health clinics and federally qualified health centers, conditions for certification and conditions for coverage to allow marriage and family therapists and mental health counselors to provide additional behavioral health services in these facilities. CMS is also finalizing, as proposed, revising the definitions of several healthcare professionals who are already eligible to provide services at rural health clinics and federally qualified health centers, including nurse practitioners. The revised definition for nurse practitioners includes the removal of the requirement that they be certified in primary care to provide care in these facilities. CMS believes that removing this requirement will aid in addressing staffing shortages that healthcare facilities are experiencing in underserved and rural communities by increasing the number of nurse practitioners eligible to provide care in rural health clinics and federally qualified health centers. This is it for today. I have broken down Medicare physician fee schedule final rule for calendar year 2024 into part 1 and part 2. I am currently working on developing part 2, so please stay tuned for that video. If you found this information useful, please consider subscribing to my channel. Thank you for watching. Bye now.